multifocal intraocular lens with modified prolate anterior surface. Please.
My experience with the multifocal, this Tecnis multifocal is limited because I've always been very skeptical about multifocal lenses, and my follow-up is short. But I'll present to you my impression and the problems and the benefits we have had with the Tecnis multifocal lenses. The Tecnis multifocal lens has a prolate anterior surface with negative spherical aberration, which compensates for the positive spherical aberration of the cornea. It is pupil size independent. Its performance is less affected by mild decentration. It has a near add of +4 diopters, which translates into a spectacle correction of +3.2 diopters. And it has 32 concentric diffractive rings, which distribute light equally for distance and near. It has a haptic capsuloceal design, which provides an optimal centration. We have done 63 eyes of 51 patients. 78% have been females and 22% have been males. The preoperative spherical equivalent has ranged from -1.4 to +1.75 diopters. The scotopic pupil size has ranged from 3 to 6 millimeters, and the IOL power implanted has been from +18 to +24 diopters. The following were excluded from the study: the corneal astigmatism greater than 1 diopter, scotopic pupils larger than 6 millimeters, unilateral cataracts, monofocal IOL in the other eye, or any other ocular pathology, patients with high expectation and high visual demands, and frequent night drivers. The preoperative examination was done very thoroughly. Keratometry was performed with an autokeratometer. The pupil size was taken into consideration, and the biometry was done both with immersion and the IOL master. And uncomplicated phacoemulsification was within the bag IOL implantation was performed in all cases. Follow-up was done at day 1 week at 1 month, and the parameter studies were inflammation, UCVA for distance and near, residual refractive error, contrast sensitivity, and subjective questionnaire was given to each patient. The results for distance were at 1 month, 94% of our patients had an uncorrected visual acuity of 6/9 or better, and 100% of the patients had an uncorrected visual acuity of 6/12 or better. At 1 month, there was no statistically significant difference between the mean target refraction and the mean achieved refraction. Again, for near vision, at 1 month, 82.4% of our patients had a UCVA or uncorrected visual acuity of N6 or better, and 94% patients had an uncorrected visual acuity of N10 or better. Increasing the light, however, improved the reading comfort and reading speed, and that also was something that we noted. Contrast sensitivity for topic was marginally at 1 month with the Tecnis multifocal was comparable with the conventional monofocal, although it was less than the Tecnis monofocal lens. The subjective questionnaire showed that about 72% patients were highly satisfied, 16% patients were fairly satisfied, 10% had difficulty in intermediate vision, and 2% had glare. The complications that we noticed were a fibrin reaction in one eye, which was treated with steroids, and a PC plaque in one eye, which was treated with YAG laser. In conclusion, Tecnis multifocal IOL provides a good unaided distance and near correction. The main problem encountered was difficulty in reading at intermediate distance, which was the main problem. Glare and halos were minimized, probably due to the prolate anterior surface of the lens, and also that we chose all the cases which had scotopic pupils less than 6 millimeters or 6 millimeters, and the overall satisfaction rate with this lens has been very high. And I would recommend this lens for implantation procedures.
The next speaker is Dr.
Are there any questions?
No. Okay.
Thank you.
Thank you. Thank you.
The next speaker is Dr. Mastro Pasqua, visual performance and capsular biocompatibility of the implantation.